Rebecca, do they have a point with this letter? Ambulance workers are saying they're being demonised. There have been comments that have been condemned this week from ministers. Grant Shapps, one of them, saying ambulance staff were putting lives at risk by going on strike. Health Secretary Steve Barclay saying strikers made a conscious choice to harm patients. Do ambulance workers have a point saying they're being demonised?
Well, they have a point, but I agree with the point. This is the problem, really, because, you know, people's lives are being put at risk. And if there's one thing that I don't understand about these strikes is that nurses as well, they're all complaining about conditions, and they couldn't be more correct. The NHS is a shambles. There's far too much money spent on people of ridiculous positions that have absolutely no relevance, whereas the people at the bottom of the chain are not being sufficiently supported. But the problem is, if we keep paying the existing people more, where are we expected to find more money to help people at the bottom? Obviously, get rid of the people at the top with the ridiculous titles. Couldn't agree more. But if we just keep on paying you more, we're not going to solve the problem of the NHS being broken.
Well, the government says it has to come from existing budgets.
It does.
Day-to-day spending or capital spending, or either?
It has to come from a lot of different places. You have to look at every single which way. You know, if they were a private healthcare service, they'd have been shut down a long time ago, and they'd have been looking at stripping back the costs in every which way possible. So I don't care where it comes from within the NHS, if I'm perfectly honest, but they do have to relook again at what they do and actually put their hands up and go, our archaic system is absolutely broken and we need to do something about it.
I wanted to ask you about this story on the front of the Times this morning. Got lots of people talking at home this morning. It's about training more of our own doctors, having more homegrown talent rather than relying on foreign workers. Darren's been in touch. Thank you for getting in touch, Darren, saying, I wanted to add a comment about homegrown doctors. My daughter's been trying to get a place in a medicine degree, but the places for home students in Scotland is roughly 10% of available places. To fix it, priority should be given to home students, maybe sponsored by the NHS, and lock in with a minimum work contract with the NHS. They can't immigrate to other countries. And that's what the Times is saying, that only 16% of applicants here in the UK are actually getting a place at university. Do you think we need to be focusing more on homegrown talent and homegrown doctors?
Absolutely. It's perfect common sense. Why on earth are we not doing? You know, and then from my perspective, as somebody who went through law school later on in life when fees are £9,000 per year, it's absolutely extortionate. It cost me £70,000 to do my training in law, and that is just ludicrous. We need to start addressing that as well. I'm really prioritising our people and looking after them and getting them. We've got fantastic talent and we don't support it.
Yeah. Would you lift the cap that the government has on the number of medical places available to train as a doctor?
Yeah, absolutely. Why not? I don't understand what the logic is behind it. So, of course, yes.
Yeah.
But then, of course, it's retaining that talent, isn't it? I mean, if you bring this talent through the ranks, and then we've got the same issue again of pay and working conditions, which is exactly what we're seeing at the moment with these strikes.
Yeah, and I think that the working conditions are the biggest problem with this. From what I've seen, you know, and I've worked for private mental health care, and we have delivered NHS contracts, so I know that structurally how it's broken. If they start to address that and start to take away the 127 forms before you start to even talk to a person, then actually maybe more people will be enticed. If we put the human first, then we would be solving a whole lot of problems, and that is not what is happening in the NHS at the minute.
Yeah, speaking of solving problems, they're trying to sort out a new deal on the Northern Ireland Protocol to unlock the deadlock, as it were, in Northern Ireland at the moment. Keir Starmer gave a speech yesterday in Belfast, which frankly looks like it's directly aimed at Rishi Sunak, talking about we need to get away from this Brexity cult, which clearly was a message saying you don't need to worry about the ERG because Labour will back you if we have to have a vote on a new deal for Northern Ireland. What do you make of it?
I'm sick of hearing about both of these parties because they're both full of nonsense and we can't trust any of them. Obviously, we are in a position right now where I don't think that trust has ever been lower in the government. But the problem with Labour is all they're doing is saying what people want to hear. And I don't genuinely believe in anything that they have to say. Keir Starmer adapts every 10 seconds to what he thinks that people want, whether it's actually true and whether they've got real plans to back it up. No, what will happen is Labour potentially, unless we come up with a fantastic plan to unite centre right, Labour will get into power, and then we are going to be back in the same position where we've got a failing government and nothing's going to change. So I have no time for Keir Starmer whatsoever. I don't care what he's got to say because it's all a load of nonsense.